Hello and welcome. Today we'll be exploring a fascinating and sometimes problematic condition affecting the urinary system, bladder diverticulum. Join us as we delve into the causes, symptoms, diagnosis, and treatment of this often overlooked ailment. So, what exactly causes a bladder diverticulum? In simple terms, it's an outpouching or a sac-like formation in the bladder wall. There are primarily two main types. Congenital diverticula are present at birth, often arising near the ureteral orifices, the points where the ureters connect to the bladder. These are usually due to a weakness in the bladder wall development. Acquired diverticula, on the other hand, develop later in life. These are typically caused by increased pressure within the bladder, often due to bladder outlet obstruction. Common causes of obstruction include benign prostatic hyperplasia or BPH in men, urethral strictures, and neurogenic bladder dysfunction. This increased pressure weakens the bladder wall over time, eventually leading to the formation of a diverticulum. Now, let's understand the pathophysiology. When high pressure is sustained inside the bladder, it searches for the weakest point in the bladder wall. Over time, the mucosal lining starts to herniate through the muscle layer. As the diverticulum enlarges, it can impair complete bladder emptying. It essentially acts as a reservoir where urine can stagnate, leading to several potential problems. This stagnant urine becomes a breeding ground for bacteria, increasing the risk of urinary tract infections or UTIs. Also, because the diverticulum wall often lacks the muscular layer needed for effective contraction, it can further contribute to incomplete emptying and urinary stasis. Bladder diverticula can occur in people of all ages, but the epidemiology varies depending on whether the diverticulum is congenital or acquired. Congenital diverticula are more common in children, particularly boys. Acquired diverticula, on the other hand, are more common in older men due to the high prevalence of BPH, but they can also occur in women or individuals with other causes of bladder outlet obstruction. Due to underdiagnosis and often asymptomatic presentations, the true prevalence is likely underestimated in the general population. The signs and symptoms of bladder diverticula can vary greatly. Some individuals may be completely asymptomatic, especially if the diverticulum is small. However, when symptoms do occur, they often include recurrent urinary tract infections or UTIs, frequent urination, a weak urine stream, and difficulty emptying the bladder completely, which is known as urinary retention. Patients may also experience lower abdominal pain or discomfort and blood in the urine, also known as hematuria. In children, recurrent UTIs are often the main presenting symptom. Diagnosing a bladder diverticulum typically involves a combination of imaging studies and potentially urodynamic testing. Avoiding cystoarthrogram or VCUG is a specialized X-ray that visualizes the bladder while the patient urinates, allowing for the detection of diverticula. Cystoscopy, which involves inserting a thin, flexible tube with a camera into the bladder, provides a direct view of the bladder lining and can help identify diverticula and other abnormalities. A CT urogram or MRI of the pelvis can also visualize diverticula and help rule out other conditions. Urodynamic testing, which assesses bladder function, can help determine the underlying cause of the diverticulum, such as bladder outlet obstruction. While not always formally classified, bladder diverticula can be broadly categorized based on their cause, congenital or acquired. As we mentioned earlier, they can also be classified based on their size and location within the bladder. Giant diverticula are large outpouchings and sometimes encompass a significant volume of the bladder. The location, such as near the ureteral orifices, is crucial as it determines their potential to cause symptoms like urinary reflux. Treatment and management strategies depend on the size of the diverticulum, the presence of symptoms, and the underlying cause. For small, asymptomatic diverticula, watchful waiting may be the preferred approach, involving regular monitoring and management of any associated conditions, such as UTIs. For larger symptomatic diverticula, surgical removal, called diverticulectomy, is often recommended. This can be performed through open surgery laparoscopically or robotically depending on the surgeon's expertise and the individual patient's anatomy. If the diverticulum is caused by bladder outlet obstruction, addressing the obstruction, such as treating BPH or repairing a urethral stricture, is crucial to prevent recurrence. In cases where surgery isn't feasible, intermittent catheterization may be necessary to ensure complete bladder emptying and reduce the risk of UTIs. While it's not always possible to prevent congenital diverticula, there are steps you can take to minimize the risk of developing acquired diverticula. These include managing conditions that can lead to bladder outlet obstruction, such as BPH, and seeking prompt treatment for urinary tract infections. Maintaining good bladder health through adequate hydration and regular urination habits can also help prevent the development of acquired bladder diverticula. The prognosis for individuals with bladder diverticula is generally good, especially with appropriate treatment. Surgical removal of the diverticulum is often successful in relieving symptoms and preventing further complications. Regular follow-up is important to monitor for recurrence and to manage any underlying conditions. Recent research focuses on refining minimally invasive surgical techniques and investigating the genetic factors that may contribute to the development of congenital diverticula. Some studies are also exploring new ways to improve bladder emptying in individuals with neurogenic bladder dysfunction, which can help prevent the formation of acquired diverticula.